Here's Pat on the line from Lindsay. What are your thoughts, Pat?
My husband passed away, and how we did it was we just kept him home.
Yeah.
Because when we had him in the hospital, they kept, even though he had a do not resuscitate order, he kept being moved to other hospitals.
Yeah.
And as a result, they did, I guess his do not resuscitate order didn't go with him.
Oh.
And he was brought back one day 6 times. After that, we just brought him home and kept him at home. From the first time he saw the doctor said you can drop dead at any day. So for 4 years, we put up with that.
4 years.
Yeah.
Wanda, what are your thoughts?
Well, I think you bring up a really good point, which is the importance of having an advanced care plan, knowing what you want and having that spelled out in writing and having somebody there to advocate for it. And as much as we really believe the law should be changed, we think many more people will be helped simply by having an advanced care plan.
Yeah, but the do not resuscitate thing, in fact, didn't work very well, did it?
No, and what we know and what we've seen is that it's really important to have a substitute decision maker who's willing to be active to advocate on your behalf. And at Dying with Dignity, we also have an advocacy program where if someone's rights aren't being recognized, we'll get involved in support as well.
If assisted suicide, let me ask you this, Pat. If assisted suicide, in fact, were legal in Canada, would you have taken some action in your case?
If my husband had wished it, yes, I would, because the fact knowing that he was dying gave us the opportunity to look at all the options.
Right.
And most definitely. I mean, he suffered tremendously.
Did you ever have that conversation with him?
Yes, and he would have told me when he was ready.
I see, yeah. But in any event, he died somewhat peacefully at home.
He had a massive stroke sitting at his own kitchen table.
Yeah. Well, at least it wasn't in the hospital.
No, it was not, and he wasn't going back, and we weren't allowing it anyway.
Yeah. Pat.
And that was our way of respecting his wishes.
Pat, thank you. Thank you very much for that story. Here is Medi. Is it Medi?
Yes.
Hi, Medi. What would you like to say about this, please?
Yeah, I've been a nurse in palliative care for 17 years.
Uh-huh.
And I've seen a lot of patients with terminal illnesses. I really believe that there is still a lot of public and professional education to be done in order to promote this dying with dignity. I advocate for good pain control. I have to tell you that sometimes, in my experience, some patients, when they're in severe pain, for example, of course, they want to die. They don't know that there are a lot of resources. There are a lot of medications that can be given regularly and with the doctor's order. The lady that was the prior was talking about the husband, I believe, is in pain and short of breath. Shortness of breath, there's a lot of things that can be done because there are oxygen, there are morphine inhalation, there are all kinds of drip, and I believe in that case of the nurse who is reluctant to do something about it. That is what I mean, education. The nurse should be educated, and not only the nurses. Sometimes the doctors need.
But the doctors,
the fear of addiction, the fear of client will, or patient will eventually die. But if the patient is dying and has terminal illnesses, wouldn't we like them to die, peacefully and pain-free, symptom-free? And I think that is very important.
I think you're answering your own question there.
Yeah.
But of course, doctors have to be willing to prescribe those pain relievers, and the notion that someone would become addicted to some painkiller is ludicrous when you're talking about a terminally ill patient, isn't it?
Of course, but what I'm trying to say, in the hospital where I work, fortunately we have an excellent doctor, and then we give the nurses, as a nurse, we were told, because I know that if a patient is in pain, the nurses will only follow the regimen like every 4 hours. But they are not aware that there is what we call a breakthrough pain medication. That means a pain in between the regular medications. And, I have to tell you, we have a patient that, she was in pain. As soon as we started the regimen of pain medication, she got better. She was able to mobilize, and I think it's very important.
She wasn't terminally ill, you mean, in that case?
She was. So she's in palliative care.
Oh, I see. Yeah, okay. Wanda, what are your thoughts about what Medi is saying?
I think she raises an excellent point that a lot of people, they might say, I want to die. And if they're probed, we find out it's because they aren't getting good palliative care, aren't getting good pain control.
They don't necessarily want to die then. They want to be out of pain.
Yes. And so the important part about legalizing it is that it allows people to have the conversation. Right now, if someone says that their doctor is, oh my goodness, no, we're not going there. But what we know of in places like Oregon, they have much better care because they're able to have the conversation. And then they say, well, the doctor can say, well, why do you feel that way? And then they can find out that it's a pain control issue.
But a doctor in Canada would be breaking the law even by talking about it, right? Well, because it does say give counsel right in the criminal code. So it could be interpreted, could it not, that you can't even talk about it? The doctors would worry about even mentioning the subject.
It's certainly a legal gray area, and the doctors are not going to bring it up. We know from our experience that there are doctors that when they hear it, they will talk, and of course they'll check to make sure there's not a psychiatric issue that's present as well. But I'd also like to respond to the point about pain control, because for people that are asking for assistance at end of life, it's usually that's only one small part of it. I mean, if we take the situation of Leslie LaForest, she is a woman who was one of the people that provided evidence in the BC case. She had anal cancer. Her doctors wanted her to have some surgery, and if she had that, it would have meant that her vagina was really scarred, so that intercourse would be not possible, and even just urinating would be painful. But if she didn't have the operation, the tumor that she had would grow and grow until she was unable to eliminate her own waste. Her body would swell with the toxins, and she would eventually literally be vomiting feces. So while palliative care can do so very much, there are situations where it's not enough.
So it's beyond pain in many cases. It isn't just the pain.
It's not just the pain.
Okay.
Yeah, well, I agree with you, if I can interrupt, because when you are in palliative care, you're not only looking about physical pain. You're looking at the whole area. It's a holistic approach, right? And then you're looking like, for example, constipation. People don't want to talk about constipation, but that's pain itself if you are constipated. But there are a lot of things the nurses can do, the doctor can do, and I think it's looking at the whole client or patient care. You know? And I think, because 17 years in palliative care, I learned that it's not only one symptoms.
Yeah.
A good pain and symptom control is very important.
Maddie, thank you very much. And you'd certainly agree with that, would you not, Wanda?
Absolutely. Yeah. And what I'd be really excited to see is legislation that brings forward both, that legalizes end-of-life choice and greatly expands our funding for palliative care.
All right. 12:32, we'll take a bit of a break and stand by if you're on the line. We will get to you. If you're intending to call, I have one line open, but keep trying. We'll be talking about this right through until 1 o'clock.
Goldhawk Fights Back for You airs Monday to Friday, 11 to 1 on AM 740, Zoomer Radio.
12:37. We're talking about dying with dignity, among other things, of assisted suicide. 416-360-0740 or 866-740-4740. Wendy is on the line from Tiny Township. Wendy, what would you like to say?
I was a RN for 20 years downtown Toronto Hospital. And after I had the